Dr. Andrew Oswari here with us today, who is a family medicine integrative doctor based in New Jersey. Andrew, thank you so much for coming and sharing your story.
Thank you very much for having me.
Tell me about yourself and your practice and where you're based and the kind of work that you do.
So I graduated medical school from Loma Linda University Medical School in 2000. I practiced traditional family medicine until about 2005 when I learned acupuncture and decided to go a different route and pursued integrative medicine and joined my mentor, Dr. Chung, at the Chung Institute.
And obviously you did the Nutrition Network trainings. Tell me about how you found out about low carb and carbohydrate restriction.
Earlier in my career, I helped teach the medical students, and I actually taught them diabetes. And 90-minute lecture every 6 to 8 weeks for all the students that rotated through our department. And so I knew well what diabetes and the consequences would be. Mm-hmm. In January of 2019, I had a hemoglobin A1C of 7.2.
Okay.
I was devastated because I couldn't believe I had diabetes. I felt like I ate normal, healthy actually, with a more vegetarian diet, but it was very difficult for me to lose weight. I had yo-yo dieted all my life, and here I was with diabetes. In February, I had a patient who would come in monthly. I was treating for back pain, and I saw that she was getting slimmer, and I asked her, "What are you doing?" And she would say, "Keto." Up until this point, every time she said keto, I would just blow it off and continue to treat her.
Yeah.
But this time, I said to myself, I have to do something. And so my brain at that point could only find a Facebook group. I joined that group, I set my macros, and I started doing it on my own.
Okay, wow. So you literally found this, as a doctor, you found it on Facebook. Isn't that incredible?
Yes. So sure. 2 weeks into it, my brain fog lifted. I didn't realize I had brain fog. And I must have had it for at least 2 or 3 years because I don't remember reading a book during this whole time. And I used to read books all the time. That week, I read 2 books. And that's when I found Nutrition Network and started doing your programs.
So amazing. So obviously you said you were teaching diabetes to medical students. So what were you teaching? If it wasn't to do with nutrition and if low carb wasn't in there, it's unfathomable. So I haven't studied medicine and I'm not a doctor. So for me, it's unbelievable that you could teach diabetes and food wasn't an intrinsic part of that.
So I was taught the traditional, insulin resistance, your sugar's going up, diet and exercise is the way to treat it. The complications, the number one cause for blindness and amputations and renal disease and cardiac death. I did the causes and the consequences, but never really the treatment except for medicines.
Medication, yeah.
Yeah.
Amazing. So what would you change now? I mean, have you integrated that? Are you still teaching diabetes and have you brought the knowledge into your trainings that you offer now, or was that
so I actually want to go back to the students and be able to teach them because I know we can reverse diabetes. I've done it. I've done it to myself. I've done it to patients. And I just know that this is the way to do it. And so that's what I want to train them. They need to be taught, because I was never taught, how to treat and cure diabetes with, I won't say cure, I say reverse diabetes with nutrition.
So talk to me or us about how you actually went about reversing your own diabetes and what you did and what steps you took.
So I went with the traditional macros that I found on Facebook, honestly. I did the 25% protein, the less than 25 grams of carbs, and the 70% of fat.
Okay.
And that was my macros that I stuck to in the beginning.
So what did you eat? What was your typical daily consumption?
My breakfast at that time was a bed of greens.
Hmm.
Um, I actually preferred a hamburger, uh, and I would put olive oil on top of that. That
Mm,
was for breakfast.
mm,
Lunch was typically a simple protein with salad, and dinner was also the same with a little extra added olive oil on top of
mm.
that.
And how long did it take? Where are you now? So you said it was 2019, so it hasn't been very long. You've been about a year and a year and a half
Yeah,
almost. Is that
yeah.
correct? So what is your HbA1c now, and how long did it take you to kind of see the actual maximum benefits?
So most recently it was 5.5.
Okay,
My
amazing.
insulin level went from 27 to 7.
Wow, that's
Um,
incredible.
my cholesterol numbers are actually fine,
Okay.
and but more than that, what low carb has given me is it's gotten rid of my daily headaches.
Mhm.
I was terribly irritable at the office. In fact, I remember several times wanting to walk out as soon as I saw my schedule because I just couldn't handle it. I
Mm,
would come home and I would go straight upstairs to my bedroom and just try to relax for an hour because I
mm,
couldn't handle even my kids at that point. That was gone. I have had chronic reflux my entire life. That was gone. My
wow.
irritable bowel was gone as well. And since then, I've just been a sponge trying to learn as much as I can about
Mm.
traditional low carb,
So,
therapeutic low carb, sorry.
so tell me about some of your patients that you've managed to treat in the same way.
So the first lady I saw, a 73-year-old lady, was on 60 units of insulin uh, once a day with the Humalog during the day as well. Um, with the low carb and the fasting as well, we were able to get her off the insulin within 3 months.
Wow, that's incredible.
Um, I I have direct patients that we've treated with diabetes, but the indirect ones are just as incredible as well.
Mm.
Um, Family members that are now doing low carb have been able to teach their parents who've been on insulin for 15 years and gotten off of it. I
Mm.
had a nurse practitioner student who was rotating with me, and she had seen what I was teaching my patients as well, and she brought it to her father, who got off insulin as well. So
Incredible.
those are the victories that are really exciting as well.
Absolutely, absolutely. So, what were the challenges that you found in your own journey of adopting low carb?
So traditionally, we are taught, we're really pushed on the cholesterol myth.
Mm.
Um, I now that I've looked into, listened to podcasts and read books and things, and yeah, it makes so much sense now. But when I was trained, I was never taught that carbs and sugars. It didn't
Mm.
click to me that, yeah, that's what leads to insulin,
Mm.
necessity for insulin.
Mm.
So I still have traditional thoughts. And for instance, if I see a high cholesterol, even though I know that's not the end all of the disease, I don't even know if that's the beginning of the disease, to be honest. But when
Mm.
I see the high cholesterol, there's a part of me in the back that thinks, "Oh, what do I do here?"
Mm.
And if it's hard for me, who's lived the lifestyle, then I can't even imagine how it is for my colleagues who have no idea about
Mm.
low carb.
Yeah, it's unbelievable that cholesterol is still such a big impediment for many people. So, what advice do you have for colleagues that are going through the same story? I mean, obviously, a lot of the colleagues that you work with and the people that study medicine haven't got diabetes and have to they haven't been through the journey that you've been through, where they've had that shock and they've had to find it for themselves. But what we know is that it's ideal to introduce that and offer that to patients when they are diagnosed with diabetes. So,
Sure.
what advice do you have in terms of actually having the confidence to give it as one of the offerings to a newly diagnosed type 2 diabetic?
when I started this early on and I took the Nutrition Network course, Professor Tim Noakes it touched me, not because of his knowledge and I know what he's gone through, but for the simple fact of saying, when I found out, I knew I was wrong, and how he ripped up his books and how he apologized to the masses. You know, if us as doctors would humble ourselves and really start looking at things scientifically, or in at least a different view, and be able to be open to this new information, and be able to tell ourselves, you know what, maybe I was wrong at this thing, and let me look into this more. I think that's where change would start to occur within each individual. In the meantime, we just continue to live our life, and we live as an example, and try to teach them as much as they are willing to learn.
Very, very true. So how has you talked a lot, you talked about your integrative practice and how you believe in integrating different models of Eastern medicine. How does that play into this and into the practice, into the work that you do?
Up until about a year and a half ago, the majority of our things was treatments. Treatments with supplements, treatments with antiparasitics, with acupuncture, with neural therapy, herbs and things like that. But I always felt there was a nutrition piece that was missing, and I feel like we found it, and now we're really, really treating the whole person completely.
So do you typically put a diabetic patient onto an integrative plan where diet is one component of it, and then you include the other elements of your previous practice as well now? Or how
Absolutely.
do you integrate these things?
Absolutely. And I'm happy and I'm excited to be the dietitian part of it.
So how has that changed from before? I mean, typically I'm thinking of all the many kind of integrative doctors that I've been to over the last couple of decades prior to keto. And it was always like green juices and, very, very green plant-based diet. How has that changed in the way that you support patients since you've found keto and low carb?
Well, I'm Seventh-day Adventist, and I went to Loma Linda University, and so I've been mostly vegetarian my entire life, and I do believe in vegetables, but it didn't work for me. I got up to 240 pounds. My wife and I together have lost almost 100 pounds together, going low carb, and so we as a team, my wife and I, as a team, try to meet people where they are and make the changes in order to get to the place where they need to be.
Amazing. Sure. Thank you for sharing that. That's beautiful. I'm wondering what advice you have for patients that actually, obviously there's a huge range of patients with diabetes, and in this particular module, we're really focusing on diabetes reversal. So it takes quite a leap of faith for many people who have been newly diagnosed and who are on the path of kind of medication, standard American diet, exercise, low fat. How do we support diabetics to take the brave step towards going onto a keto diet and really reversing their diabetes in an alternative way?
Sure. Well, I'm fortunate to be one of the examples for them, first of all. And there are many, many success stories out there now. I try to teach them about the insulin level and what insulin does. And I used to think insulin only took sugar out of the bloodstream. I don't remember ever learning that it stores fat and it prevents the breakdown of fat. I never remembered that part, if I was ever taught that. So education is definitely one of the bigger pieces for it. And then showing them that it is definitely doable. I think one of the biggest barriers for patients is the psychological, the emotional component to eating, especially in the United States. I mean, there's a part of me that's still, after my daughter's softball game, want to take them to uh, an ice cream place for a
Yeah.
treat, you know. So I think we've grown up um, just believing that food is a reward,
Mm.
trying to teach them that food is actually a healthy medication that will help reverse the disease.
You mentioned that you've got some photos of your before or what you used to look like. Will you share those with us?
Sure, absolutely.
So tell me about which courses you've done on the Nutrition Network and what your experience has been of them.
So to be honest, I've taken all of them,
Oh,
except
wow.
except for the nurses module. But I've taken all of them, even the mini courses from Dr. Kaji with the COVID and the immunity, Dr. Wellington's course about the reversible diabetes, and I'm very excited for the July course, which I just saw is being released. So I'm very excited for that one as well.
Amazing. And how have you found them? How has it supported you with your learning and your knowledge?
They're phenomenal. I think the speakers that you have are top notch. Um, I like the quizzes that we have to fill out, or else we can't move on to the next module. So you can't just like ignore them. You have to really watch them. And I've gone through them a couple times. They're so valuable.
Wow, that's amazing to hear. Thank you for sharing that. So why do you think this information is not taught at medical school?
Ooh, I think traditional medicine has what do you call it? We've used a microscope to teach diseases. So we teach the disease and we teach the treatment. There isn't even much time to talk about the family and their relationships and the environment that they've grown up in. And nutrition is actually a very, very small part of the schooling. I understand there's just so much information that we have to teach, but there are some things like nutrition that we just cannot ignore. Not anymore, at least.
So what changes would you like to see if you were to look, into the future of medicine? Where do you think it should be heading, and what are we doing wrong at the moment in the way that we treat patients?
Well, at least in the United States, we are paid by how really the outcomes. We're not really paid to keep them healthy. So that might be one way of doing it. But I know that even my sister, who's a family medicine doctor, she gets rewarded or penalized by the number of folks that are on cholesterol medicines based on their cholesterol levels. I think that needs to change. But it's very difficult at this point. Obviously, we know how important nutrition is and metabolic health is just because of the last 3 months with COVID. And so hopefully our eyes will be opened and we'll be able to reach more people.
Thank you so much for sharing your story. I really, really appreciate it. Is there anything else you'd like to share about your journey with diabetes or with the trainings that you've done that we haven't covered?
I just want to encourage providers to keep an open mind, to keep looking, to actually believe that we can reverse diabetes and hypertension, which I didn't touch on before, but I've taken several patients off hypertensive meds. So keep an open mind, stay humble, and for us who've been sick, there is a lot of hope. A lot of hope that we can reverse disease now. And it's brought the joy back into medicine to me, for me.
Beautiful. It's brought the joy back into medicine for me. Beautiful. Thank you.